Okay, so today we are going to be doing the 3-step peel. So this is going to be a great peel for deeper fine lines, texture, melasma, acne scarring, orange peel skin, laxity, really any skin concern that you're struggling with, the 3-step peel is great for. What Chanel is doing right now is she is just prepping the skin with just a little bit of alcohol to make sure that we have great penetration of our 3-step peel. So she will go over the skin a few times to make sure your skin is nice and prepped and ready. Once she has completed the degrease, she will go into the peel solution. Typically this step takes, around 1 to 2 minutes. This peel is a salicylic, TCA, and lactic blend. So one of the great things about this is, again, it will really help with that deeper textural issues, laxity, fine lines, and wrinkles. As she goes across the face and puts the peel on, you will start to see something that we like to call powdering. It's the salicylic dissolving off of the face and leaving a film behind. Sometimes, in some cases, you will see something called frosting. It is protein coagulation in one spot. It just means that your skin is done in that spot. It's completely normal to have that frosting, and hopefully as we get further into this peel, you'll be able to see an example of frosting. Typically what you can feel from this peel is you can feel a little itchy, stingly, tingly, burning, a little bit of sensation, but pretty common with this type of peel. We are going down to the basal layer of the epidermis, so you're going to get a really nice deep exfoliation from this, hopefully revealing nice, beautiful, fresh skin. So now you can see something called powdering start to happen. You see just like a nice white cast across the face. That is completely normal. It's just the salicylic dissolving off the face. That is exactly what we like to see. So far, so good. Sometimes you can see a little bit of redness forming. You may be a little bit pink, red after the treatment. That is completely normal. So now you can kind of see up on her forehead, she is starting to frost. That is that protein coagulation. That is pretty normal for these types of peels to see some frosting. That just means that her skin has reached a clinical endpoint, meaning that it probably, the peel won't penetrate any deeper, and we've gotten the max amount of peel solution in the skin, basically, is what it means. Typically with frosting, those areas you will see them shed first. You'll see a lot of peeling in that area first. Sometimes those areas will start to get darker before they get lighter. It's something called peppering. If that happens, that is also completely normal. But this overall looks like a really great result. And now we're gonna go into the retinol cream complex. So with this peel, the solution only goes to the epidermis, but with the 6% retinol packet, this is gonna give you that dermal stimulation. So you're gonna get extended results from this across 6 weeks. So even after you're done with the peel, you'll still be seeing those results start to develop over the next 6 weeks because of the retinol packet. This portion, again, you can feel a little sensation on the face. It's completely normal to put a 6% retinol packet on top. This also will help bring the pH of the skin back up. This retinol packet, you will also receive one in your home care, which you will apply the next day in the morning, but your BoMD provider will walk through your aftercare instructions in office. So we're just gonna keep on working this into the skin, keep massaging it into the skin. And then once we finish this step, we will go into our hydrating cream to really take the heat out. The hydrating cream that she's using today will also go home in your take home. So whenever you're really starting to get into your peeling, you can use it as needed, or if your skin is feeling dry, you can use it as needed. The hydrating cream is really going to take out some of the heat from that peel, and you will really start to get comfortable, or it'll really start to feel comfortable. Sometimes whenever you are getting up from the treatment chair with this peel, you can look a little bit yellow, a little bit orange, maybe a little bit of an olive green color. It is the peel oxidizing, so depending on your skin type, or your Fitzpatrick, it can look a little bit of a different color. Right here, she's oxidizing to a little bit of like a yellowy color, maybe a little jaundicey looking. That's totally normal. If you had fake tan on your face prior to this, you may turn a little bit of a green depending on the undertone of the fake tan. Again, it's totally normal, and by tomorrow morning it won't be there. And that concludes our 3-step peel.